who actually has a PhD in this subject. So I also want to acknowledge a previous colleague, Stefan Swiss, who did a lot of the analyses that you're looking at here. And I guess that's part of my take-home message is I worked closely with Stefan. Now, he knew the technical side of this very, very well, really, really well. I mean, we were doing these analyses 8-9 years ago when nobody was really thinking about this, certainly not in public health as far as I could see, and not in vaccination. These analyses are still not very standard practice, right? Which for me is a little bit surprising. So let's go through a bit of background. What is this? What are some of the key concepts? And then we'll get to some kind of concrete examples of how it might be applied to your work. I'm going to give you these slides after, so I'm not going to read through all the slides, right? What Joe and I have done is tried to give you a bit of an overview of the subject, a condensed overview of the subject that you can refer back to later. So you'll get this as a PDF later. But essentially, this approach is understanding social structures through the use of network and graph theories. So it's really understanding, mapping and understanding how we interact. And I guess my other take-home message is it's interesting and important to understand how people interact with content on social platforms, but it's probably more interesting and more important to understand how they interact with each other, just as it is in the real world. And I guess that's the third take home is a lot of what I'm going to show you is maps and work done on social networks, on online social networks, because we can do it more easily on those, right? You know, we can crunch the data and do it on those, but you can do this in the real world as well, in communities, etc. And often that can be very, very telling as well. Oops. This is becoming a topic of interest. So what does this allow us to do? It allows us to understand those relationships between people and to start to organize our data based on user behavior. So to understand how groups naturally form around interconnections that arise out of discussions of specific topics or specific characteristics such as, you know, common location or common interest. And it also allows us, and this is really important, to locate the important central people or sources or accounts within these groups who are having more influence. There are a couple of key authors in this field. I'll refer to Fowler and Christakis' work a couple of times, but we know that social networks are key to adoption of new technologies and behaviors. And therefore, this research can have significant implications. It can provide significant insights, not only into the implications for research, but insights into practice in disease control, management of mis and disinformation, and also, you know, the spread of innovation and other knowledge, attitudes, and behaviors. There are lots of different networks we can analyze. What you'll be seeing here in large part is that middle bold one, you know, the social networks on social platforms. But there are many, many different networks we can analyze, right through to, down the bottom there, as I've already mentioned, you know, offline social networks in communities. And I'm going to show you a really nice example of that. So that means that we can literally do simple in-person mapping exercises, which are actually, and I'll give you this example from this paper from Christakis and Fowler in 2010. I'll come back to this, but they mapped out a social network within college dorms in a US college or university, for those of you who aren't from the US. And we can go from that all the way to really, you know, accessing big data to understand the interactions of thousands or millions of individuals, the networks that they form, etc. So it's about relationships, right? And when we draw these graphs, the graphs are always indicating relationships between individuals, which then gives you the kind of structures of communities, etc. So it can be a directed graph where it's going from one individual to another. It might be a reply or a mention, or it can be undirected. So it's the relationships where you've followed people, someone has followed someone else, and so there is a flow backwards and forwards between those two nodes or accounts or people. So a few definitions, and if there's some of these that I don't know, I'm afraid that's how it is. So nodes, we talk about nodes. These are the actors or the accounts upon which these relationships that we're showing by the lines or curves act. And the edge is the nodes the relationship between those nodes, which I've just shown you, the directed or undirected. So these are nodes, okay? And often, well, we'll come back to the size of the nodes. And these are the edges, right? The connections between those two nodes. Now, we also have, as you see down here in the middle, cohesive subgroups or cliques. So these are groups of actors that actually share multiple connections. So kind of moving, cliques, kind of moving towards, tiny mini communities. So we have maps, social network analyses, the graphics that we produce. The position of the nodes is important, the size and the position. So a node that is on the periphery of one of these maps is less central, literally, within the network. I mean, it's a bit, I'm kind of explaining the obvious, but, and that means, it means it's less important in terms of diffusion of information, knowledge, and potentially behaviors. Then you have central connectors, which is a node that has above average centrality. So it's more central to the network. And I'll come back to this because, as I've just noted, these are the accounts, the people who are having a greater influence potentially within the networks. And that means that is something that we can leverage in many different ways, not just in terms of, for example, information diffusion. And then you have brokers, and these are interesting nodes, especially within the context of infectious disease, but I think also for mis and disinformation, which are the nodes that connect between groups. There are some key metrics there. I'm not going into these in detail today because I don't think they add much to our conversation today, but you'll get this slide, okay? So I want to give you an example of what an analysis, a social network analysis, what you might call a fairly simple one, can tell us. So this is a map of a college, well, we call them colleges in Australia, so of a dorm within a college in the US. And they tracked the spread of influenza in the season through this network. So I'm going to play an animation. You'll see that when a red node appears, that means that the person is infected with influenza. And you'll also see immediately around that infected person, yellow nodes, which are the friends of that infected individual. There we go, the first case is appearing. You'll see that yellow start to become red for obvious reasons. You'll see the spread within the center of the network in particular. And we could imagine that, you know, information would spread in the same way, or misinformation would spread in the same way. There's a lot of information in this animation, at least for me, and a lot of corollaries that we can draw from it. The first interesting principle here that you could imagine being applied to vaccination strategies or test strategies for COVID-19, for the coronavirus, is that they looked at the impact, or their ability to detect early the spread of the virus using two samples. One sample was just random individuals, so basically sentinels randomly chosen. The second sample was the friends of randomly chosen individuals. And this is a really interesting principle in social networks. When somebody nominates a friend, that person will almost certainly be more central within the network. And so what they found was that they could detect the epidemic 2 weeks in advance in that friend group versus a random sampling, because those people were more central to the network. We could also imagine which people within this network would be the right ones to vaccinate first. We could also imagine that this approach could be taken to a kind of a surveillance, a surveillance program, say with rapid antigen tests, right? We know we can use them. We can use them quickly. They're pretty good. They're not perfect. Rather than taking random samples to detect outbreaks, we could ask those random people to nominate a friend, and we're probably going to increase our ability to detect outbreaks earlier by doing that. The same team 7 years later looked at both the spread of virus within a network, of influenza virus again, and compared that to vaccination, so the individuals who got vaccinated. And again, there's some really interesting conclusions. The people more likely to get vaccinated were actually the well-connected people, or people who are exposed to people who get vaccinated. So, you know, we've known for a long time that social influences, that social norms are important for many people's decisions around vaccination. And this is an illustration of that as one of the key determinants of vaccine decision making. What was interesting also is that people exposed to people who got the flu were also more likely to be vaccinated. So this is disease salience, you know, or threat salience. Once they saw someone who was sick, that made this solution, this coping solution, more relevant to them because they now understood the threat more clearly. And this is one of the challenges we have with vaccination, is making a threat that is no longer visible for many of the diseases that we vaccinate salient for people, so that they feel compelled to seek that solution, vaccination. So I've kind of covered this a little bit reading a graph, but I thought we'd just have a look at Twitter because I'm going to show you some Twitter graphs. So, and there's a few additional principles here. So the size of the dot, the eigenvector, actually is the size of the fish in the pond, right? So a bigger dot means that it's a bigger fish connected with other bigger fish in the pond. So those with higher scores, or bigger dots literally, have more connections. Their connections have more connections, and the connections of their connections have more connections. So these people are having an influence, or potentially influential within those networks, you know, shaping people's perceptions, channeling information to them, channeling opinion to them, etc. The links that are drawn between the dots show that direction of intent that we've already seen. Inbound means someone's mentioned me or retweeted me. Outbound means that I've retweeted or mentioned somebody. And so we can tell quite a lot from a graph like this. We can see who's aware of whom, who's getting attention, who's involved in conversations on specific topics, and I'll show you some examples of this, and who's central to those topics, or those conversations, sorry, and who's more peripheral, and how are they connected. Yeah, we don't need to go into that. So here's a map of Twitter that we drew in 2013. There were some interesting events going on in Australia. The No Jab, No Play campaign had begun. There was the measles outbreak at Disneyland, which everybody was watching. But all I want to show you today is we could clearly identify the top influences in this conversation around vaccination and the connections that they had, which gave us a snapshot of that online conversation. We can see both, so the color coding is not important in this graph in particular, but we see both pro-vaccine accounts and vaccine critical accounts. The pro-vaccine accounts in general are larger, but there are a couple of very large critical accounts as well. But this is an interesting snapshot that allows us to see, for example, amongst those pro-vaccine accounts, who's influencing who, who's reaching who, and the same with the vaccine critical accounts. We can also start to see how when we up the volume of the data, we can start to see how we can start to see bigger clusters. So, you know, communities interacting or not with each other. So this is, again, measles and vaccination search string related search strings. This is the US. This is a couple of years later. So it's the measles outbreak in Disneyland. Sorry, the previous one wasn't the measles outbreak in Disneyland. I got that wrong. And we've had we kind of selected for accounts with a certain eigenvector score. So we eliminated a lot of accounts that are really, really peripheral. And what we saw was real clusters that weren't necessarily interconnected. The pro-vaccine cluster, bottom right, green, were pretty much talking to themselves, but so at this point were the anti-vaccine cluster up at the top left. The mainstream media, as you might expect, was kind of interconnecting things in that middle piece. We had press and journalists who, you know, were having some influence, but not getting that far, et cetera, et cetera. So this again is an interesting snapshot that allows us to just start to understand from at a macro level what conversations are happening, but more importantly how they're spreading and how they're interacting. I think things have changed a little bit, but back in 2015, what we found was that often the media was actually amplifying the vaccine critical content through you know, suboptimal reporting. So false balance, a lot of false balance in the reporting still in 2015. So vaccine critical accounts getting equal share or at least mention in mainstream media. Things have improved, I think, since then. Now, hopefully, many of you have seen this publication now in 2020. Exactly, very similar approach. Got a lot of visibility, got a lot of coverage, which is great. You know, a lot of the work done earlier on in the decade really didn't get much media coverage.
Heard from Angus about this study, which I also, I mean, I think it's just objectively fascinating. One of the powers of social network analysis is that we all have educated assumptions about how information travels through offline and online social networks, but to actually see it visualized can be really powerful. And for those of us who part of our job is explaining epidemiology and health communication and misinformation spread to policymakers and other stakeholders that we have, I have found these sorts of visualizations to be extremely helpful in getting buy-in for program budgets and resources, oftentimes the math is really complicated and too complicated for people, and they don't really have the time to dig into it. But a visualization like this just makes it so clear what the problem is and what the potential solutions are. And I thought I would share with you all just a funny story. I did my postdoc, my postdoctoral training at the US CDC, and I was working on a big anti-tobacco campaign. It's CDC's largest campaign every year. It's the one with the most funding. And so they have the most ability to do a lot of different sorts of strategies because there's money there. And it's a public education campaign for the American public on the risks of smoking and taking and using tobacco products. And I had come in to that program being able to perform social network analyses, and I used one of the tools that I just put in the chat. I connected the CDC's tobacco control Twitter account to one of those tools, which is a really simple process. And I just started running an analysis to see, just like this study that we're looking at right now, I wanted to see who the CDC was reaching with its anti-tobacco educational messages. And I won't say how much we were spending on Twitter, but it was not an insignificant amount. And we had a bunch of external expert marketers helping with the campaign, and we were making images and video, and it was a very we thought a very strategic approach to using Twitter. Well, when I ran the analyses, I was confronted with reality, and the reality looked a lot like what we're looking at in this visualization. It was, despite our best efforts, we had been reaching the majority of the people that we reached with our messages worked in public health. so it wasn't the American public at all. It was the CDC talking to people who already agreed with the CDC and who did not smoke. And then even more interesting, when we looked at, okay, so we're reaching mostly people who work in healthcare and public health. But when we did another analysis, the majority of those people lived in Georgia, in the state of Georgia in the US, and the majority of those people lived in Atlanta. So we were spending all this time and effort on this public education campaign, basically tweeting at CDC employees. So I could have just talked to the person sitting next to me in the cubicle next to me. And I think that's not unique to the CDC. It's a problem we're just facing constantly in public health, is unless we have a more creative and strategic way of reaching at-risk populations and the public who normally would never pay attention to us or follow our social media accounts, what will end up happening is we only reach people who already agree with us. And I think this visualization represents that very well. I should also mention this was years ago at the CDC, and when we presented our findings, they immediately changed tactics and things got better. But that shows you one of the power of these sorts of analyses is with not a lot of training, using just a free tool, you can become a really valuable member of whatever team that you're on. If you understand these really basic principles of social network analyses, and if you watch a few YouTube videos and just get familiar with how to use this the software, you don't need to be a mathematician or a statistician even to be able to give people really valuable information that might end up saving hundreds of thousands of dollars every year because people just didn't know what was happening out there in the real world. So I just wanted to share that, not because I wanted to throw CDC under the bus. I love the CDC, but I've gotten permission to share that story before, so I thought I would share that story. Just one public health person to the rest of you. With the Mexico case study, this was also interesting, and I think it just reflects again the previous study and the anecdote I just shared with you all is this was a separate kind of analysis. What they looked at, if you're talking about flu vaccinations and influenza immunization campaigns, this was specific to Mexico. It was a social network analysis done using Twitter data, and again, it was another example. I would argue it was nobody's fault. Nobody necessarily did anything wrong. This is just part of this is almost to me like a process evaluation. They didn't frame it that way, but if you're running a program, a social network analysis could just be part of the work that you're doing on a routine basis to be able to tell if things are working or not. And it won't give you all the answers, but it will help you. It maybe will be directional evidence. And in this case, that's what this study found was the federal government was not connecting to regional public health authorities across the country. They weren't echoing each other's messaging, and they weren't following each other on Twitter. So they weren't speaking in a unified voice. It was a disjointed effort. And that's among people who maybe were talking to each other professionally, and who had the same goals in mind, but that commonality, that common sense of purpose, wasn't reflected in their use of social media. And this certainly is not specific to Mexico. I think this is just a study that happened to be published, but I would argue this is probably reflective of almost, you could choose your country almost. This is a really common problem, and I would say here in the U.S. where I am. We see this problem today, right now, around information about vaccination and immunization programs. You'll have a state in the U.S., one of the 50 states in the U.S., the state health department will not be coordinating with local health departments, with city health departments. They might all be on social media, but they're not reflecting what each other is saying, and they're reaching different audiences. So it continues to be a problem. And I think it's just, it's another example of, with a little bit of training and all the training you all are going through. I mean, you're the first batch of the world's infodemiologists, which I think is really exciting. This is just one more tool in your toolbox that you can leverage in ways that you see fit. Part of what I hoped you would get out of this training is just a little bit of, you're kind of dipping your toe into social network analysis. And if this excites you and you find it interesting and you want to learn more, this is such a rich area of research, and there's so many resources and very powerful free tools that are available. You could go as deep as you wanted to in this, and from a professional career development point of view, or from a public health practice point of view, I think there's a tremendous amount of opportunity. Actually, I think the risk is, if you got good at this, we wouldn't be able to keep you in public health because you'd be hired by Facebook and Google and Twitter. So don't get too good. Please try and stay in public health. I taught at a graduate course in epidemiology at Columbia University in New York City. And so these were people who were getting their master's or PhD in epidemiology. And after they learned a little bit about social network analysis and they were able to perform some pretty simple tasks, half of my class was stolen by Google. So they didn't go on to work in public health. They went and they worked for Google. So I'm personally responsible for the workforce shortage in our field. And then if we go on, just again, this kind of shows you the main accounts, the focus on Mexican government and the health authorities. You can kind of see there were, so we have some main accounts there that you see on the, I guess it's the left-hand side of your screen. But there are particular nodes in any network that have a lot of people paying attention to them. And again, I think this is just one of the powers of the tool, is if you can connect your Twitter account to one of these free services, or if you do get good at the math, and you're doing even an offline social network analyses, in the process of doing the work, you can identify these very influential accounts or organizations or people so you don't have to worry potentially about getting information to everyone. In the US, we have a saying, boil the ocean. And that's usually what public health is trying to do, is we try and boil the entire ocean instead of focusing on the most impactful place for us to spend time and money. So it's something we all contend with, of course. But you might be able to surface, oh, well, if I just talked to 6 users of Twitter, it turns out that a ton of people pay attention to just these 6 people, and so I don't need to talk to 500 different organizations. I could just talk to 6, and as long as we're all saying the same things, we might have just as much of an impact. And of course, there's downsides with learning what reality looks like too. But just to show you, it can be a very powerful tool. And this, you can see, this study used data from 2013 and 2014. We are much more advanced now in 2020 than we were, even 7 or 6 years ago. In many ways, it's almost an entirely different world. People are more connected now than they were, even 5 years ago. So I think these tools and this area of research and public health practice is even more important now than it was 5 years ago. And I would see that to continue. I would expect that to continue. This picture is not from me. This is from Angus put this in there. But what you're looking at here is a story, just to illustrate our point. One of the things that I hear all the time when I'm doing trainings on social network analyses is, well, not everyone all over the world is using social media, and not everyone has access to the internet. And that is certainly very true. There are even very big parts of the US where people don't have access to the internet and don't use social media, although that continues to change every year. But what this picture is showing is, this is a real story. In Papua New Guinea, there was somebody who was climbing a tree in order to get internet access with their phone, and they were getting the news, and they were then on their phone, and the only way they could get it, the only place where they had access to the network was climbing a tall tree. They would collect the news, and they would climb back down the tree, and they would go back to their village and tell everyone what the news was. And I think all of you probably have some story like that. So there is more and more, there's a blurring between the people who are completely connected all day, every day to social media and the internet, and people who think that they aren't, but they are, because somebody else is. And my own anecdote that I would add to this is, I often hear in the US, people will tell me, oh, well, I'm not on social media, and none of my friends are on social media. None of my professional contacts use social media. I just listen to the radio and watch the news. And I think that's fair. But my response is often, well, did you know that much of the news is determined by social media? Most news organizations these days have monitoring systems, and they're monitoring, just like we're talking about today, they're monitoring Twitter, and they're monitoring Facebook and all the other sites, and they're looking for a spike in anyone sharing information that's about to tip into the public consciousness. So they're looking for that thing that's right about to tip, right about to get a bunch of shares, and for a lot of people to see it. And they've created very sophisticated algorithms to alert them right before that tip occurs. And then that is what becomes what you read in the newspaper and what you watch on television, the news that you watch on television in the evening. So as much as people might think that what happens online doesn't impact them, I have found that more and more that is not true. We are all much more connected than we used to be, even if we're not personally, using Facebook. So I think, and Angus covered earlier, there are plenty of examples of, once you understand how to use these tools and the concepts behind them, you can go into a rural village in any country, and you can perform a social network analysis the exact same way. There's nothing different about that kind of analysis as there is with a Twitter analysis. It's the same math, it's the same tool, and it presents you the same kind of information. Who's most influential? Who's most connected to other people? How does information flow? And then where can we focus an intervention if we're trying to identify how misinformation is spreading? Where is it starting? Or who should I talk to counter misinformation? Who is a potential ally? So just to throw that out there. We are working at UNICEF with this new kind of framework, something we're calling the Vaccine Demand Observatory, and this is part of that work, is thinking about, okay, so how does this work in the real world? You know, you all are public health professionals already, and you're getting additional training in infodemiology. I think it's very timely, because those of us who already know a little bit about social network analysis, we're also trying to figure out, how do we operationalize this? We might know the math end of it, but how does it actually work from we've identified misinformation, we've verified that it is misinformation, we need to then create a counter message that reflects the best research on messaging, because we don't want unintended outcomes. So what does the evidence say about the way that we structure a message? And then how do we get that message in the hands of partners and stakeholders and allies at the community level, and give them what they need, what they say that they need, and then rely on them to reach the populations and the communities that trust them more than they may trust us, the original source of information. And unless all those pieces work together, the whole system as a whole just won't work. So there's a lot of moving pieces, and so we put this slide together just to give you a sense of parallel conversations that are happening these days around, from the very beginning to the very end, when the counter message or the inoculation message gets in front of a member of the public. What does that process actually look like behind the scenes? And certainly, if any of you have ideas or you would like to be involved, I think we would welcome that, because we certainly need more. We certainly need the help. And then I think that just leads me to my last slide, which is I think it's three very simple but very important points. How we interact with each other is as important as how we interact with content. And I think that is so true. That's one of the things that really comes through in the visualizations and in the math of social network analysis. Is it is all about relationships, and the messenger is equally or more important than the message. And that's something that this sort of work can show pretty easily, pretty succinctly. And then a simple social network analysis can inform an initial info ecosystem assessment. That is a somewhat complicated way of saying a social network analysis can be something maybe you just do it once a year. Maybe it's not something you're doing all the time, but you're just doing it because you want to understand who is creating information and spreading that information. And then for the rest of the year, once you've done that work, that just informs who you talk to. It informs the network that you use, the partnership network that you use in your own work. It doesn't necessarily have to be something you're doing every single week. For example, to use that CDC example, we did that one time. It informed our strategy moving forward for that year. And then they ran it another time the next year, just to make sure that all of the changes we had made were effective. So it doesn't need to be this hugely cumbersome process. Like I said earlier, it's just a tool in your toolbox. You can use it as you need to. And then consider interactions between online and offline social networks. That just goes back to what I was saying earlier. Is it's not just social media analysis. There are, if you're looking for some weekend reading, there are really fascinating books and studies on social networks and social network analyses done on whales, for example. How do whales communicate with each other? And how do pods of dolphins interact with each other? And how do hikers on hiking trails interact with each other and use different trails? But once you understand the math behind it and the tools, you can apply it to a whole bunch of different situations. So for example, you could look at the ways that community health workers travel by foot or by motorbike out to different rural communities. And that is an application that you could use for social network analysis. It doesn't necessarily need to be which Twitter accounts are talking to which Twitter accounts. It's a very powerful tool to have.